Welcome to NSG 217 Study Session 1. We'll be talking about health assessment. Introduction. Can you cast your mind back to any of your visits to the hospital, where the doctors bring out some little instruments to check your body or touch some part of your body for assessment? The doctor or a health worker may even ask some funny questions about your physical health. This is called health assessment. In this study session, you will learn about the aims and components of client health assessment and the preparation of the client before this procedure. We will also discuss the equipment needed and the positions which can be assumed by the client during the assessment process. This study session will conclude with a general survey of a client, that is, a volunteer or a mannequin. Learning outcomes for study session 1. When you study this session, you should be able to 1. Explain the meaning and components of health assessment. 2. State the reasons and purpose for carrying out health assessment. 3. Describe the physical and psychological preparation of clients for health assessment. 4. Explain assessment techniques in health assessment. The meaning and components of health assessment. Assessment is a collection of data about an individual's health. Assessment and examination are terms which are sometimes used interchangeably, but refer to a critical investigation and evaluation of client status. Many times, nurses are the first to detect changes in client's condition, regardless of the setting, according to Perry and Porter, 1998. Components of health assessment. Health assessment involves physical examination and health history taking. The health history is a lengthy interview with a client and informant to gather the subjective data about any presenting conditions. When the client or patient is seen for the first time by a member of the healthcare team, the first requirement is a database, except in emergency situations. The subsequent and format of obtaining data about the patient vary, but the content, regardless of format, usually addresses the same general topics. A traditional approach includes the following. 1. Biographic data. 2. Chief complaint. 3. Present health concerns or present illness. 4. Past medical history. 5. Family history. 6. Review of systems. 7. Patient profile. However, a more popular and widely accepted approach, even though lacking a general consensus, is the Functional Health Pattern Assessment Tool, developed by Gordon. This consists of 11 functional health patterns. These: 1. Health perception and management, nutritional metabolic. 2. Elimination. 3. Activity exercise. 4. Sleep rest. 5. Cognitive perceptual. 6. Self-perception / self-concept. 7. Role relationship. 8. Sexuality reproductive. 9. Coping stress tolerance. 10. Value belief pattern. 11. Role relationship pattern. The reasons / purpose for carrying out health assessment. Nurses use physical assessment to 1. Develop or obtain baseline data and expand the database from which subsequent phases of nursing process can evolve. Secondly, to identify and manage a variety of patient problems, actual and potential. Thirdly, evaluate the effectiveness of nursing care. Fourthly, enhance the nurse-patient relationship. And lastly, make clinical judgment. Types of data in health assessment. There are two: the subjective data. This is as explained by the client and obtained during health history. The objective data is observed by the nurse and obtained during physical examination. Physical and psychological preparation of clients for health assessment. Pre-examination preparations. This involves three aspects. First one, preparation of clients. The second, preparation of environment. And lastly, preparation of equipment. 1. Preparing the client physically and psychologically. Almost everyone appreciates and indeed needs an explanation of the physical examination. Clients are often anxious about what the nurse will find. A tense, anxious patient will not be able to go through many of the physical maneuvers required during an examination or to cooperate with the instructions of the nurse. You may reduce client anxiety and fear by conveying an open, receptive, and professional approach. Your facial expression and the tone of your voice should be relaxed to put patients at ease. They can be reassured during examination by providing explanations at each step. You should also remember to explain using simple terms when and where the examination will take place, why it is important, and what will happen. Assure the client that all information obtained and documented is kept confidential. This means that only health professionals who have legitimate need to know the client's information will have access to it. The clients are prepared physically by encouraging the client to empty bladder and change his or her clothes. You should also help the client assume proper position during the examination so that the body parts are accessible and the client stays comfortable. Assessment techniques. The techniques of health assessment are four. They are inspection, palpation, percussion, and auscultation. The acronym for this is IPPA. Summary of this study session 1. In this study session, you've learned that 1. Assessment is a collection of data about an individual health. Assessment and examination are terms which are sometimes used interchangeably. Number 2. Health assessment involves physical examination and health history taking. Number 3. A traditional approach includes the following: biographic data, chief complaint, present health concern or present illness, and past history. Number 4. Nurses use physical assessments to develop or obtain baseline data and expand the base from which subsequent phases of nursing process can evolve. Number 5. Pre-examination preparation. This involves three aspects, that is, preparation of the client, preparation of the environment, preparation of equipment, and number 6. The techniques of health assessment are four, and they are inspection, palpation, percussion, and auscultation. Thank you. We've come to the end of this study session.